Office of the Clerk. Thank you.
Thank you. Media.
Good morning, Chair. Good morning, honorable members. Good morning, PS and team. My name is Muchana Lwemba from News Diggers.
Thank you. PS and your team. I'm Warren C. Mwambazi, Member of Parliament from Bwanamkubwa constituency in Ndola district of the Copper Belt, and I'm the chairperson of this committee. I'll ask you to proceed to introduce your team.
So, good morning, Chairperson. Good morning, honorable members of Parliament, the team from the Auditor General's Office, Accountant General's Office, the Controller, and my team. I'm actually battling a flu with a lot of malaise, but just because of the importance of this occasion, I decided I should nevertheless join you. Eventually, I'm going to be assisted by my colleagues. I am Dr. George Sinyangwe. I'm Permanent Secretary responsible for donor coordination at the Ministry of Health. Right.
Good morning, Chair. Good morning, honorable members of Parliament, and everyone. I am Siamkwis Dennis, Director Human Resource and Administration from Ministry of Health. Thank you.
Good morning, Chair. Good morning, honorable members. Good morning, everyone, colleagues. My name is Raphael Simfu, Director of Finance, Ministry of Health.
Good morning, Chair. Good morning, honorable members of this committee, and good morning, everyone. My name is Madren Balambuta. I'm Director for Policy and Planning in the Ministry of Health. Thank you.
Good morning, Chair. Good morning, honorable members. My name is Lisa Siame, Principal Accountant.
Good morning, Chair. Good morning, members of the committee. I'm Dr. Scott Ndlovu, Director Internal Audit.
Done. Thank you, PS. I don't know where Zamsa is not here. Because in your submission I'm saying engage ZAMSA. I want them to speak for themselves. So ZAMSA is supposed to be here. Because and every time you come they should come. The guys from procurement, I don't know if it's a DG or whoever is responsible, they should come here and explain themselves. Thank you, PS, for the introductions. We're wondering, sure you've seen notes flying around, people asking where's the controlling officer, but I think the clerk has indicated. Maybe you can just help us.
So my substantive position is that of a permanent secretary for coordinating donors.
Yes.
But I'm also standing in over the last 1 month as a permanent secretary responsible for administration.
Administration. Okay, that's good. That's good. Thank you, PS. You're welcome, and I hope and trust that you'll come with competent officers who help you answer some of these questions. That's why looking at your submissions, we're going through seeing reference to ZAMSA. I think in communication, our clerks also ensure that ZAMSA do appear, because eminently they have to make submission or help you answer some of the queries pertaining to the Auditor General's report. And I've not heard anyone from thank you. PS, you are conferred with immunity in accordance with Cap 12 of the laws of Zambia, which gives you immunity as you make submission before this honorable committee. You've got 2 paragraphs, paragraph 22 and paragraph 23. I want you to proceed and make submission, starting with paragraph 22, and you'll be guided as we proceed. You are free to make your submission.
So we'll start out with paragraph 22. Our mandate is to provide equitable access to promotive, preventive, curative, palliative, and rehabilitative quality health care services at all service levels. 22.2 Budget, funding, and expenditure. In the estimate of revenue and expenditure for the financial year ended 31st December 2023, a total provision of 18.2 billion kwacha was made to cater for various activities, which amounts, a total of 18.2 billion was made to cater for various activities, against which 12.1 billion was released, resulting in an underfunding by 6.1 billion kwacha. As at 31st December 2023, amounts totaling 12.1 billion had been spent, leaving a balance of 19.3 million kwacha. Breakdown of what was funded. So the first column is,
I think we can skip the table. Go to management response.
Management
tables. PS, you should be skipping tables. Just refer to them. Table 2, then you skip it.
Thank you so much.
Thank you.
In addition, the ministry received other funds in amounts totaling 6.9 billion from cooperative partners, Cabinet Office, NIMA, and other sources, out of which amounts totaling 6.8 billion had been spent, leaving a balance of 117 million kwacha as of 31st December 2023. Management response. The observation made by the auditors regarding the budget, funding and expenditure is acknowledged. The committee may wish to note that the ministry had an approved budget estimate of 18.2 billion kwacha, out of which an amount of 12.1 billion was released by the Treasury, leaving a balance of 6.1 billion in the year under review. Kindly note that the ministry received other funds in amounts totaling 6.9 billion from cooperating partners, Cabinet Office, NIMA, and other various sources, out of which amounts totaling 6.8 billion was spent, leaving a balance of 117 million kwacha unspent. I wish to inform the committee that the underfunding to the ministry impacted negatively on the implementation of budgeted for activities in the health sector. Several write-ups had been made to the Treasury requesting for funding in order to implement various activities. It is, however, regrettable that an amount of 19.3 million remained unspent as of 31st December 2023. This was due to the fact that the Treasury released the funds at the end of the year, making it difficult for the resources to be utilized. However, the ministry applied for retention of these funds to be utilized on earmarked activities in the year 2024. See Appendix 1. 22.3 Audit findings. An examination of accounting and other records for the financial year maintained at the ministry headquarters, provincial health offices, and select district health offices revealed the following. 22.3.1 Compliance with registration / regulations. A. Management of payroll and staff related matters. 1. Failure to provide information regarding operations of the Human Resource Management Committee. Section 73(1) of the Public Financial Management Act No. 1 of 2018 requires auditees to provide all necessary information requested during an audit. During the period under review, the Civil Service Commission established a Human Resource Management Committee at the Ministry headquarters and delegated 5 functions to the committee, which included confirmations, substantive promotions, transfers on an exchange basis, normal retirement, and retirement on medical grounds. The committee held 4 sittings and processed 2,499 cases in 2023. Contrary to the Act, documentary evidence such as appointment letters, terms of reference, or guidelines, minutes of meetings, and reports were not availed for audit. Management response. The observation made by the auditors regarding failure to provide information on the operations of the Human Resource Management Committee is acknowledged. The committee may wish to note that the Human Resource Management Committee for the Ministry of Health headquarters held 3 sittings in 2023, that is, in May, August, and December respectively. However, the ministry did not avail the appointment letters, terms of reference, and/or guidelines, minutes of meetings, and the reports to the auditors at the time of the audit. The committee may wish to note that the Civil Service Commission Directive on Guidelines and Terms of Reference regarding the formation and nature of cases delegated to the Human Resource Management Committee or the Ministry, together with the appointment letters for the members, were availed to the auditors at the time of audit verification. I therefore wish to inform the committee that the appointment letters for the members of the HRMC MC and minutes for the 3 sittings held are attached. See Appendix 2. 2. Weakness in the management of staff establishment register. That is non-existent salary scales on the staff establishment register. The Treasury, in the Financial Management Circular number 9 of 2020, provides that a controlling officer should ensure that reconciliation between a staff establishment register and staff assignment and reconciliation of staff assignment to staff returns are done monthly. Contrary to the circular, during the period under review, salaries in amounts totaling 593 million were paid to 1,534 officers on salary scales which did not exist on the staff establishment register, resulting into difficulties in reconciling salaries paid to officers to the budgeted amounts. See table 2 below. Management response. The observation made by the auditors regarding weaknesses in the management of staff establishment register of non-existent salary scale on the establishment register is acknowledged. The committee may wish to note that of the 1,534 salary scale not accounted for, a total number of 1,516 have been accounted for in salary scale J2, which is the correct salary scale for junior resident medical officers. 7 salary scales G22, J22, JSS09, SPF and KI were corrected on the payroll, while the remaining 11 salary scales APH, DPH, EPH, GPH, HPH, KPH and SPH belonged to officers who were placed in personal to order salary scales because their salaries were correctly higher than the prevailing salaries in the civil service. The committee may also wish to note that the queried salary scales have since been updated and reflected in the ministry's establishment register. See Appendix 3.
So PS, you proceed, you read the query, the heading of the query, the amount involved, and then you proceed to management response. Looking at this, your submission is slightly bulky and you've got paragraph 23. So just read the query, the heading, the amount is where it's applicable, then the management response, how to make some progress.
Thank you so much. Weakness in the management of staff recruitment. Recruitment of 3,000 healthcare workers. Failure to utilize positions with Treasury Authority. In August 2023, the Ministry of Health through the Civil Service Commission advertised for recruitment of 3,000 healthcare workers. The recruitment was conducted through various committees constituted at national, provincial and district levels. In 2023, the Commission released a list of 2,674 successful health profession candidates for deployment in various health facilities across the country and left a provision of 326 positions for general workers to be recruited locally in the provinces. A review of the payroll and staff assignment revealed that as at 31st August 2024, a total of 50 newly created positions with the Treasury authorities had not been filled. Management response. The observation made by the auditors regarding recruitment of the 3,000 healthcare workers and failure to utilize positions with Treasury Authority is acknowledged. The committee may wish to note that at the conclusion of the audit verification, the queried positions had not yet been filled. The queried positions remained vacant because of the long processes and procedures associated with the operations of respective human resource management committees at district levels through to the provincial level. The committee may wish to note that as a measure to address this matter, the ministry held a fast-track exercise in conjunction with the Civil Service Commission and the Public Service Management Division to process recommendation on the queried positions. Kindly note that as at October 2024, 37 positions out of the queried 50 had been filled and introduced on the payroll. The ministry is still waiting to receive authority letters to fill the remaining 13 vacant positions from the Civil Service Commission, and these positions will be filled once all payroll placement modalities are finished. Attached is the list of the 37 positions filled. See Appendix 4. Questionable introduction of employees on payroll. Management response. The observation made by auditors.
So yes, just as your officers are helping to guide you, once you read that, just reference to table 3, then management response. Maybe just also mention the number of the amount where applicable. You can proceed.
Okay. Questionable introductions of employees on payroll. During the period under review, 5 officers in 3 districts were introduced on the payroll through transfers on first appointment and paid salaries in amounts totaling 79,000 kwacha. See table 3, introduction of employees without supporting documentation. Management response. The observation made by auditors regarding questionable introduction of employees on the payroll is acknowledged. Central Province. The committee may wish to note that the conclusion of the committee may wish to note that at the conclusion of the audit verification, documents supporting payroll introduction of 4 officers queried could not be availed as their files were collected by Zambia police to aid some investigations. The committee may wish to note that the files for the officers queried are still under investigation. Attached is a police report. See Appendix 5A. Muchinga Province. The committee may wish to note that documents for the officer queried could not be available to the auditors at the time of audit verification because the officer was physically based in Western Province. Kindly note that the officer in question was appointed to the civil service on the 16th November 2010 as a radiography technologist in Western Province. Kindly note that the officer has never worked from Muchinga Province, and the movement on payroll was a misplacement which was later corrected and his pay point normalized. See Appendix 5B. 4. Weakness in administration of terminated officers. We now go to the bullet point, irregular payment of salary to deceased officers. A review of the payroll and other records revealed that 20 officers were paid salaries in amounts totaling 939,000 kwacha for periods ranging from 3 to 12 months after the date of death notice. Reference table 4, salaries to deceased officers. Total 939,000 kwacha. Management response: the observation made by the auditors regarding irregular payments of salaries to deceased officers is acknowledged. The committee may wish to note that 13 officers queried under the Ministry of Health headquarters consisted of 9 officers who were working at the Invest Teaching Hospital, Adult Hospital, 3 officers from the Levi Mwanawasa, 1 officer under the Cancer Disease Hospital. The remaining 7 were drawn from Central Province, Copperbelt Province, Southern Province, bringing the total to 20. I wish to inform the committee that duly completed and ordered terminal leave competitions with evidence of recovery of regularities paid with evidence of recovery of the irregularly paid salaries were presented to the auditors at the time of audit verification. However, the query could not be resolved on the premise that the officers' terminal leave claims were not yet paid to enable recovery of the queried salaries. The committee may also wish to note that the provincial health directors and senior medical superintendents were duly charged for this payroll anomaly